Everyone. Good evening, everyone. I am RCDSO President Dr. Harinder Sandhu. Welcome to tonight's RCDSO Connect session. Thank you for joining us. This evening session is an information-only event and does not qualify for continuing education points. But we are very happy that you have joined us to learn more about an important organizational update. The transition of the Professional Liability Program, PLP, to Navacord, one of Canada's fastest growing multi-line insurance brokerage. The session is designed to help you better understand why the transition to Navacord was made, what this change means for Ontario dentists, and how it will affect your experience with PLP moving forward. Before we begin, I would like to take a moment to walk you through what to expect this evening. RCDSO Registrar and CEO, Mr. Dan Faulkner, will start with a presentation that provides some background on the college decision to divest from PLP and transition to Navacord. This decision represents a significant change, and we want to ensure you have a clear understanding of the rationale behind it, what it means for you, and what you can expect moving forward. Following the presentation, our Director of Communication, Ms. Leslie Byrne, will lead a question and answer session. Leslie will ask questions submitted during registration, as well as those that come in live through Zoom. You are encouraged to submit your questions at any point during the session. We want this to be as informative and responsive as possible. We also have college staff on hand to help answer questions and answers and provide clarification when needed. Our goal is to ensure you leave tonight's session with a better understanding of the transition and how it affects your experience with PLP. Thank you again for joining us. We appreciate your time and engagement, and we look forward to a thoughtful and productive conversation. With that, I will turn things over to Dan. Dan, over to you. Thank you.
Thank you very much, Harinder, and good evening, everyone. I really appreciate you joining us this evening. Before I start my presentation, I'd like to recognize the privilege of gathering online this evening by sharing a land acknowledgement. The RCDSO is on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples. These traditional lands are known to some as Toronto. Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is home to many diverse First Nations, Inuit, and Métis peoples from across Turtle Island. This land is also part of the Dish with One Spoon territory, a treaty between allied nations to peaceably share and care for this land. We accept our responsibility to each other and this land we live and work on in a spirit of peace, friendship, and respect. We are committed to actively supporting the necessary work towards truth, reconciliation, and equity. We embrace our role in regulating dentists, in protecting the public interest, and strengthening our partnerships with Indigenous communities to advance access to safe and equitable oral health care. Thank you. I'm going to share my screen and start my slide deck. And again, I want to thank everyone for being here this evening. It's a great opportunity for the college to provide you with very accurate, timely, up-to-date information about the PLP divestment that many or all of you have heard about to some degree. And I know there's a lot of information that's out there, and we have tried to design this presentation so that it will address a number of the questions that we've heard along the way. We've heard many, and we've really tried to design it to address what we think are some of the hot button issues And as Harinder said at the end, we'll have a bit of time to go through your questions that you asked us before you signed up or while you signed up for this event, and also ones that might be on your mind tonight that might be in reaction to something that I say or present or something else that's been on your mind. But I want to start by just really giving you a snapshot of what I know are some questions that are on the minds of dentists as I've gone out to speak to various groups over the last couple of months. You can see these on the screen, the why, the what, the how, the when, all of these things that are here plus more. I will try to do my best to give you information that will help you to understand the divestment of PLP from the RCDSO. And I'll also come back at the end of the presentation and talk a lot more about transparency of this entire process. So let me begin by talking a little bit about the why. Why are we divesting PLP? Why are we divesting a program that has been with the college for over 50 years? That some or many of you might say, this has been a successful program. Why is the college moving away from it? And we asked ourselves that question a number of times over the last few years and really tried to bring forward a lot of the assumptions that were made about the program, and particularly about a regulator operating a malpractice insurance program. And in order to do that effectively, the council of the college first commissioned an expert review task force. And that was commissioned to really try to look at the risks and the benefits of a regulator, the RCDSO, operating a malpractice insurance program. And this committee did its work from February to July of 2023. It provided a report to council and it essentially focused on what you can see on the screen. And I'll be the first to acknowledge that on the right side, there are many benefits with the program, a very successful program, a very well-operated program, and also benefits to the college running it. Things like the protection of the public. The protection of the public was assured when every dentist upon renewal automatically had insurance. Access to coverage was available to every dentist. No dentist was denied. And the college could certainly think about how it might not influence cases, because there were obviously firewalls that were established, but influence how the program was operated, sort of the insurance side of it and the coverage and so on, and also what parts of practice would be covered. So clearly there have been and are benefits. But I think the more compelling arguments around this were on the left side as the task force looked at the risks that are involved in the college running this program. And they largely fell into three categories: the reputational, the financial, and the regulatory risks. And I'm not going to give you a lot of detail about each of those risks. I think financial is fairly obvious. Obviously, we are not an insurance company. We do not have the expertise. We don't have the backstop of an insurance company. And there were always going to be financial risks. You have that, 1 in 100-year event that might occur. And the college certainly was challenged in a number of different ways to make sure that the financial aspects to this program could withstand most of those risks. But there was always something that could be lurking around the corner, whether that's a class action suit or something else. And so this would obviously jeopardize the resource base of the college, the resource base that is there to ensure proper regulation of the profession by the RCDSO, which is a legislated mandate. From a regulatory side, I think there is always going to be the question that if you operate a professional liability program in-house, how can you ensure that perhaps what might be happening on the side that deals with a legal claim by a patient, where there might be competency issues that are identified and a firewall that does not allow for those issues to be shared, where you operate all of that within the same organization. And I think that poses some very unique risks to a regulator. And then last but not least is reputational. And I certainly know that I fielded some calls over the last couple of years from patients who might have had concurrent actions that were ongoing, a lawsuit against a dentist and a complaint against a dentist. And they would say to me, how do I trust you, college, when these operations are happening within the same organization. You are providing the public and the patients with an investigative process that's supposed to be free of bias and objective, when down the hall you're operating a program that is defending dentists. And that's a really tough question to answer. And it certainly calls into question the reputation of the college and the trust that the public will have in us. And trust is everything for a regulator. We want members of the public to contact us. We want members of the public to feel like they can call us and we will help them to the degree that we can, whether that's just information or something that might go to an investigation. And so when we balance this through the expert review task force, the end result was really a need to de-risk the college. And I think that's what you might take away from this presentation, that the divestment of PLP, notwithstanding the benefits of the program, entailed enough risk that the college and the council decided that it wanted to de-risk the college from a discretionary program. It's not a program that's the college is required to run. All dentists must have malpractice insurance, but for us to run it posed some very significant risks. And that is essentially addressing the why. What happened over the intervening 2 years are a number of activities that were part of our council decision-making process that led us to September of 2025, where council announced the decision to divest and who we were divesting to. So if you go back to September 2023, council had access to the full report by the expert review task force. They looked at the various options that were available. They decided that the status quo, keeping everything the same, and moving the program to a subsidiary corporation were not acceptable options. And so they directed staff at that time to explore the different methods of divesting the program. Before council could make that final decision, the college went out and conducted a member survey. We gave an opportunity to all 11,000 plus dentists to provide us with information about what they valued in the program, why they thought that it was important, and what we needed to keep in any divestment, regardless of what that looked like. We heard from 1,600 dentists, and we were able to use that information to form essentially the 8 objectives that we were trying to achieve in the divestment process, and I'll comment on those in a moment. And so with council armed with that information from the September meeting, from the expert task force, and from what the dentists told us about the program and what they valued the most, was able to move forward with a decision that directed staff to look at identifying a third party to take on ownership. And it became known to us as, how can we create a turnkey operation where the program itself is sort of lifted from the college and moved to a third party and achieving the divestment objectives that were established. So from 2024 January to September 2025, we launched a process that involved an external agency, PricewaterhouseCoopers, to help us in this concept of what we call mergers and acquisitions, but really this was a divestment part of that. All of this was overseen by a council committee known as the PRG, the Procurement Review Group, and the process was competitive. It involved an upside-down triangle of many organizations that were expressing interest, all the way through to letters of intent for those organizations that were getting more serious, interviews of those interested parties by PRG, that council committee, all the due diligence that was performed, and lots of different ways to structure the various approach that would be taken that would all be covered through legal contracts. And so all of that being said, over the course of 2024 and much of 2025, led to a decision by council to approve the divestment with the legal contracts and to sign those contracts to take effect on January 1st, 2026. And that's where we found ourselves on September 15th when we announced something that had a lot of due diligence and workup that was then made known to the profession in terms of what would happen. So I've mentioned the divestment objectives, and I want to just quickly run through what we were looking for in an ultimate third party that would take on ownership of PLP. I won't go over them in much detail, but you can see that on the left and in the middle, they're largely what I call technical. So we wanted to ensure that the minimum coverage that had existed for many years continued, and that's $2 million. We wanted to make sure that all dentists paid the same fee level and that the dentist would still benefit from what's called tail coverage. And tail coverage is probably something that many dentists don't understand or may not have heard about. It's been a part of this policy for a number of years. And it essentially says that if you retire from the profession and give up your license, if you move to another province, unfortunately, if you were to pass away, that for those acts that happened during the time that you were covered by these policies, they would continue to be covered even after you have moved to another province, for example, or retired. So that will continue as well. We wanted to make sure that the material aspects of the policy were continuing. We wanted to maintain that there was this concept of a group coverage for all licensed dentists. And also great importance was put on how we could integrate the current PLP staff, which is about 20, into the new program and the new owner. And I'm very pleased to say that that has been done. And the reason that staff were so important is that if you recall the survey that I mentioned, the staff were seen to be the greatest value to the program. I don't expect that many of you have legal claims against you, but many of you may have had an opportunity to call the program to try to get some help for a tricky situation in your practice. Maybe there was a tricky situation with a patient, very delicate, and I think to a person that we talked to, including the presentations that I've gone around to do over the last couple of months, there's a lot of applause for the staff and how they have helped the individual dentists in dealing with those situations. So it was very important for us to make sure that the staff landed appropriately and could continue the most valuable portion of this program. And I'll speak to that again in a moment as well. So those soft services, those things that aren't necessarily dealing with claims, but are dealing with helping dentists to manage some difficult challenges. And finally, looking at this concept of data sharing, we wanted to make sure that any new partner that we were involved with, the new owner, that we would have the opportunity to really start thinking about how data from legal claims, not individual data, but aggregate data, how aggregate data from complaints that come to the college could really be looked at in an analytical way that would help us to address issues of risk, develop education, and pump that back into programs that would really help and support dentists in identifying those risks that can happen in practice every day. That can be hugely beneficial, obviously for patients, but also for costing of the program. And so we saw this as an opportunity to not just give up and completely divest the program, but to really look at an organization that would be willing to work with us as we move forward on some of those aspects. And we're confident that Navacord is the right organization that is going to help to build and sustain this program. And as much as it's been valued by many members of the professional community, let's make it better. Let's really look at how to make this program stronger and to have a continued ongoing relationship between the college, the profession, and Navacord. And Navacord was able to meet all 8 of these objectives. So who's Navacord? I know that many of you probably don't recognize that name. And Navacord is one of Canada's largest multi-line insurance brokers. It's involved in a number of different arms of business. And it has a number of wholly owned subsidiaries across the country. So it's a Canadian company. The one brokerage that is a subsidiary is Jones Deslauriers, JDIMI, as it's often referred to. And that is going to be the broker for the program. And Navacord will obviously be the owner-operator of the program. And there are other aspects to the Navacord's organizational structure that will allow the staff to move and be employed and continue to manage those files. The point that I want to make here is that Navacord is not a stranger to the dental sector. JDIMI has been the college's broker for probably more than 8 years. And they also provide excess insurance to many members of the profession. About 2,500 dentists purchase excess insurance through JDIMI. So no stranger to the dental sector and the sorts of issues that arise under those malpractice claims, or those legal claims that are part of the program. The other aspect to this is that Navacord owns another brokerage in Alberta that is responsible for operating the College of Dental Surgeons of Alberta. So again, great depth by Navacord, by JDIMI in the dental sector, and you will continue to deal with the same staff who are also quite expert in the dental sector, which is hugely beneficial when you're dealing with a very sensitive, very stressful time when there might be a legal action against you by a patient. And so when we complete this process, and as I said, Navacord will take this over on January 1st, 2026, so a short time away and a lot of work that is happening behind the scenes, we will have public interest continue to be maintained as our #1 priority. Every dentist will continue to have coverage. All members will continue to have mandatory liability protection. And from 2026 to 2028, that will be through purchasing insurance through Navacord. The college will no longer operate the PLP, and that will greatly de-risk us with respect to those financial, regulatory, and reputational risks. And all of those divestment objectives will have been met. So what can you expect in 2026? Well, there won't be any changes to the 2026 renewal process. I know many of you are involved in that already. We have had the renewal up and running since October 15th, and some of you in the audience may have already renewed. But that should be seamless. For this year, it will operate in the way that you've seen if you've renewed already, in that you will pay the amount for both the regulatory side of our work and also for the amount that will be transferred directly over to Navacord, which I'll talk in a moment about in terms of the financial arrangements. The same policy wording will exist next year as it does now. There will be no material changes. The coverage will be virtually the same. And as I've said a couple of times, you're going to be able to deal with the same highly qualified and experienced staff to answer your questions and service your claims. So quite literally, you will contact the same phone numbers, the same websites. And if you're dealing with a member of the staff on December 31st of 2025, you'll be dealing with the same member of the staff on January 1st, 2026. So very much a seamless transition for you. Now, a lot of the questions that we've received has been related to fees. And I want to try to break this down for you in as simple a way as I can to first show you the total fee and what it's made up of. So if you've renewed, the amount that you have paid is $3,670. $2,170 goes towards the regulatory work. So all of those programs that we are obligated to run, whether it's a complaints process, a quality assurance process, a licensure process, and so on, those are all covered by the regulatory fee of $2,170. And those are programs that have lots of volume activities. As I said, they are required. And that's just the cost of running a regulator, which is consistent with all other 26 regulators across the province for other professions and regulators across the country. There's a regulatory fee, as you know. This year, there's also the $1,500 component. Previously, the college had estimated that to be $1,000. And I've emphasized the word $1,000 because we provided about 3 years ago an estimate to the profession who wondered what their fees went towards. And we really tried to do, I think, a fairly decent estimate, but not all costs were included in terms of running the program. But we did try to include all those direct costs like the staff, the amount that we paid for the insurance policy, and so on. So the $1,000, as we know, and I'll show you a couple of slides in a moment, was not near what we needed to actually and adequately fund the PLP component of the program. And we found ourselves having to subsidize that with the regulatory fee. And that's one of the reasons that I'll touch on in a moment, why the fee has changed from the estimate of $1,000 to the actual amount of $1,500 that will flow through to Navacord. So that's a snapshot of the total fee that you pay and the component parts to it. So what were some of the drivers in terms of the fee, and why wasn't the PLP program being funded adequately? The first slide that I'll show you is the financial outcome for the college over about 8 years, from 2017 to 2024. And you can see that the college ran a deficit for 6 of those 8 years. And that deficit, we determined, was largely due to PLP and the actual funding that was required for it. And in fact, you may remember that there was a fee increase around 2023, and we then started to plan for surpluses and to adequately fund the program because we wanted to ensure that it didn't sacrifice any of our ability to perform our legislative regulatory work. And so the green bars that you see were actually planned surpluses to make sure that we were adequately funding the reserve for PLP and adequately funding the ministry required reserve for the college and its operating costs. So again, running 6 years of deficits is not an ideal situation. This is a concept that I know will be confusing to some. It's a concept of loss provision, which the way that our PLP program was structured, we are required to record a loss provision as an expense in our income statements. And we would be driven by actuarial studies on this, but there's a lot of variation in how this number is determined and what that number is going to be that is largely determined after the fiscal year ends. And in the red box, you can see that from 2018 to 2021, there was an under budget year over year of what the actual loss provision was. And so that was due to a few factors. There were 2 class action lawsuits that changed the actuarial outcomes. The average claim size was increasing over those years, not significantly, but it was changing in an upward direction. And after 2021, we really wanted to ensure that we were adequately budgeting, because you can see that if we are actually recording an $8.6 million loss provision in our expense line, and we only budgeted for $3.5 million, that's contributing to a large deficit that might be $5 million or somewhere around that. And those are the 2021 numbers that I'm recording. So we needed to really better budget based on historical trends and actuarial analysis. So we didn't find ourselves in some of these uncomfortable fluctuations of the budget compared to the actuals. So again, another huge driver in terms of the financial uncertainty of operating a program, and also what drove some of the deficits that I previously mentioned, and also what has driven some of the better estimation of what it costs to run a program like this. And my final slide that relates to the financial piece is related to an actuarial study that we had commissioned in July, around the time when the expert task force was completing its work. The bottom line of all of these words on the page is that our PLP reserve, which has been stable at $22.5 million, and that is a reserve that is there to fund the actual claims on the books. This is money that will be paid out for existing claims. That was determined to be short. And if we wanted to be extremely cautious, the actuaries were suggesting that we increase that to $41 million. If we wanted to make sure that we were being somewhat cautious, we should go up to $29 million. And what that would have meant is that the fees for insurance by the college, if we continued to operate the program, would have gone up, because we would have had to fund that $29 million by more planned surpluses. So again, all of these factors were factors that led to why the $500 increase, and why the college and the council became more uncomfortable in terms of operating this program as an ongoing entity. I also want to be fair to the college. I've been here 5 years, but long before that, there have been a number of years, 10 of the past 19 years, the fees have stayed the same as the year before. There were fee freezes from 2007 to 2014, from 2017 to 2018, and from 2021 to 2022. So it's not like there have been increases in fees every single year. But in the past few years, we've really recognized that in order to appropriately fund, there had to be some adjustments that needed to be made. So just to summarize, why the $500 increase? Because I know that this is a topic of great interest, and I will acknowledge that it is a large amount of money, but those are the reasons. The regulatory subsidization of PLP was something that we couldn't withstand much longer, and the fee would have to go up, and it did go up in 2023, as I mentioned. The underfunded liability is such that if we maintained the program, the fee would have had to go up. The bidders would not look at the program because the $1,000 that we had estimated was not accurate, and it was not at market. And notwithstanding, as we've moved to $1,500, this continues to be a competitive rate in Canada. This is a description of the dental regulators across the country. Now, I will acknowledge that we're not always comparing apples to apples. If you look at Manitoba and Saskatchewan, their regulatory fees of $3,750 and $3,700 also include association membership. But if you look at the middle column, notwithstanding where there's hard comparisons, where those dentists in those provinces are seeking professional liability coverage, almost every province, with the exception of Quebec, is paying more than what the Ontario College is going to have as the fee for this coming year and over the next 3 years. And if you look at the total of regulatory and liability fees added together, the Ontario fee at $36.70 is still lower than almost every other province. So again, we watch this very carefully. We don't want to be the highest. We want to obviously make sure that we can operate our programs, but we also want to make sure that we are within the range of the experiences across the other jurisdictions. One of my final slides then is to address the issue of transparency. I know there have been times where I've heard from some members of the profession that the college is not being transparent, that we're not providing enough information. I really try to remind individuals who ask me that or make those statements, go to our website. You will find so much information on our website. Watch your emails from the college. We send out so much information. Our council meetings are open to the public. You can view them after the fact on our YouTube channel. There are all sorts of ways from the PLP divestment experience where we have provided information since 2023. The expert task force report is on our website. It has been since 2023. The survey report that I mentioned, where 1,600 dentists responded, is on our website. It gives you an insight into all the data that we uncovered and how we were able to extract from that data the 8 objectives. The meetings, as I mentioned, of council are all available where we've talked about PLP, and council has made decisions after very careful deliberations. All of the materials that council had available to them are also available on the website. We have dedicated web pages with lots of information and frequently asked questions. And every week we are updating those frequently asked questions because we're hearing new things. And we're trying to make sure that the profession truly understands what are the changes? What is this program divestment going to mean to me? And I've gone around over the last 5 years to many dental societies. And since 2023, I've always addressed the issue of PLP and the divestment. There has been information that I couldn't divulge when we're in the middle of a competitive procurement process. But I've also gone around in the last 2 months and talked to a number of dental societies to talk much more specifically, now that we're public, with the entity Navacord that will take on ownership and with more information that can be available. I've talked to many dentists about what's happening and what it means to them and why we did it and so on. The same thing that I'm doing tonight, although we've tailored tonight a little bit differently just to make sure that we're responding to lots of questions. I've mentioned the website. There are lots of ways to be connected to us. You can see us on a lot of different social media platforms. So if you want to follow, you have lots of ways to follow us. You can also send your questions to info@rcdso.org. You can also contact myself directly, our president, Dr. Harinder Sandhu, and we will connect you to the right people who can answer your questions. So in addition to all the transparency, we are really responding to the service experience that you would expect as you contacted the college. So I want to thank you very much for listening. What I'm going to do now is I'm going to stop sharing my screen, and I'm going to introduce Leslie Byrne. Leslie Byrne is our Director of Communications, and we have about 23 minutes left. And Leslie's going to walk us through a Q&A process that I know a number of staff have been managing as I've been talking, and also questions that came in beforehand. So Leslie, over to you.
Thanks so much, Dan, and thank you so much, everyone. I hope that Dan's overview was helpful and started to answer some of the questions that you had about the divestment of PLP. As you registered for tonight, you had the opportunity to submit a question. We got 85 questions in through the registration process for this evening, and I can see that we have quite a number of questions coming in through the Q&A. We are not going to get to all of them because we're over 100 questions now, but there are some similarities between the questions. We have staff who are answering the questions by typing them in this evening. So hopefully some of those questions will be answered, and you'll see that on your Zoom screen. But I'd like to start, Dan, with a question that's a combination of something that came in through the registration process and has also been asked through the Q&A tonight. And that is really about how does handing PLP over to a for-profit organization benefit dentists? Like how are we going to know that they're going to keep the interests of dentists at heart?
Yeah, great question. And I guess I would start by saying that I know that Navacord is a for-profit organization. And I think what the dentists in the audience also need to appreciate is that in order to run this program, we have been utilizing for-profit organizations all along. We have been utilizing JDIMI. We have had an underwriter for the program in Victor Insurance. So there have been for-profit organizations, as there must be, given the complexity of a program like this, in order to operate it effectively. And as everybody knows, these firms can change their rates. They can change a lot of different things, and the college must accommodate or adjust to those changes. And I think what happened as these various changes occurred over the last many years, that we found ourselves, as I mentioned earlier a couple of times, subsidizing the actual insurance rates, and in some ways subsidizing that through the regulatory fees, which is not ideal and not something that we wanted to do. But I think the other part to this question is really how does the profession know that Navacord will have your interests at heart? Well, Navacord just spent a lot of time and a lot of energy in demonstrating to the college why they should be the entity that takes over this program. They are not in it for the short term. They are in it for the long term. And so that means that they're going to work hard to build this relationship with dentists. And part of working hard to build that relationship is also acknowledging, which they did many, many months ago, that the staff are the secret to this. And so taking the staff who currently work at the college for PLP and incorporating them within Navacord is also going to make sure that the dentist's interests are front and center. And as some of you know, we have dentists on staff that will be a part of that. So you can be assured that your claim will not be going to an insurance adjuster. It will be going to expert staff who've been working in this area for many, many years. So I think those are some of the things that I would say to respond to the question about Navacord and how it's going to keep the dentist interests in the front and center.
Thanks, Dan. This next question comes up all the time. I think it came up on your visits to component societies. It's certainly come up tonight in the Q&A, and it's a very practical concern. How are fees going to be impacted in 2027 and beyond? What can we expect in the next 5 years for deductibles and for fees? So both on the regulatory side and on the liability side.
Yeah, great question. So let me address the regulatory side first. What you have experienced this year in your renewal is 2,170 is the regulatory component of that fee. That's been the fee for this year, 2025. You paid it last fall, and that has been frozen for the next year, which you're paying now, and the fee will be 2,170 again for 2026. So from a regulatory side, obviously, we also need to look at the fee that is required to appropriately fund the programs that we run, that we're legislatively obligated to run. But we're also quite mindful that the 2,170 fee is what you will pay for regulation going forward. So there's going to be a complete separation of the insurance side and the regulatory side. And we will continue to look at whether there are ways that we can freeze or possibly reduce the fee. But we have to obviously wait to see how some of the next few months shake out. And we'll be looking at that. So I've said that our commitment is to continue to look at the regulatory side. I can't tell you where it will go, the same up or down, but our commitment is to continue to look at it as we deal with all the complexities of this separation. From the insurance side, the fee is $1,500 this year, and the commitment is to keep the fee stable for 3 years. Now, I know that some will say, well, we want to guarantee that it's going to be stable. And I think that like any business, like any entity, whether it's insurance or otherwise, there may be extenuating circumstances or factors that have to be looked at. And I think as Navacord comes on board, they're also going to be looking at the risk profile. We've had a pretty consistent claims payout experience over the last 7 or more years. And we don't expect that that will change, but there will have to be factors that are looked at. But the intention is to keep the fee stable. And if that's possible, it's going to happen. And as I said earlier, Navacord is also going to be working on building the relationship with the profession. So Navacord wants to keep and earn your business. And so they'll be looking at all sorts of ways that they can ensure that the premium is still competitive within the Canadian marketplace.
Thank you, Dan. I think that will provide at least some assurance to the many folks who've asked that question in the chat. Here's another very practical question. Again, this came in from registrants tonight, and again, it's showing up in the Q&A today. Are we going to need extra coverage, and how do we purchase extra or excess liability insurance?
Yeah, another great question. The coverage that you will have, that you have had and will continue to have, is $2 million per dentist per occurrence with an aggregate of $6 million. So you can have 3 $2 million claims that pay out, and that's what will be covered in your policy moving forward with Navacord. We have never had an experience where the amounts paid out, the claims, have come anywhere near those numbers. And that goes back a number of years. So really, we believe, based on how we have structured minimum requirements, that the 2 million times 6 million will be enough. However, many dentists choose to purchase their own excess. And that's really your choice. That is not a requirement of the college. That's something that each individual will really understand their own risk tolerance and decide whether or not to purchase any excess insurance. And as I said earlier, JDIMI has been offering excess insurance to Ontario dentists for a number of years. They currently are providing that to over 2,500 dentists and dealing with dentists as they call JDIMI with respect to any claims that might dip into the excess insurance. That is still available. So for those who already have it and want to continue it, the offer is still there, and you can go to JDIMI and your contacts and purchase excess over $2 million.
Thank you, Dan. We have sent out emails reminding folks that that is available. And there's also a link in the portal if you're interested in excess insurance through JDIMI. This question came up both in the consultation that we did in 2023, as well as through the Q&A tonight. And it's really about the structure of how we provide coverage. So why is everyone paying the same fee? So should a person with multiple claims pay more? And how does that work, and why is that fair?
Great question. And I can speak somewhat to this because I certainly don't have the history with PLP that others might have. It is a program that I mentioned earlier is 50 years old. That was one of the hallmarks, I think, of the program when it was first established and into the most recent years, that it was felt that everyone should pay the same, that it would not necessarily be apportioned through risk or apportioned through specialty, because it was fair to have the same premium or price or cost for every individual dentist. So again, I don't have the history to truly understand why those decisions were made, but they were decisions that were carried on right up to now. And they are decisions that have carried on into the next coming years with Navacord. And so obviously, I don't have a crystal ball. I can't predict the future. But it might be for many different reasons. It might be something that others look at as they move forward to see if there is some rationale to provide coverage that really is either apportioned to general risk or apportioned to specialty risk or something else. But certainly that's not something that you should expect anytime in the near future. And it's certainly not something that the college has, how it's structured our program over the last few years. So again, I can't answer your question completely because I don't have that history, but that is something that the new owners will have to consider if that's a direction that they want to take.
Thank you, Dan. I think we have time for just a couple more questions before we wrap up for the evening, and they're still coming in fast and furious. So thank you, everyone, to that. And just know that we're busy in the background trying to answer some of those great questions that you have. What can we expect during this transition period? So in a matter of weeks, really the program will move over with all the staff to Navacord. What's the experience going to be like for a dentist who's having a conversation in December and wants to continue that conversation in January?
So it's my hope, and I believe that we will achieve this, that there will be no difference for you dentists whatsoever, that you will speak, as I said, literally to the same staff person as the staff will move to Navacord. Now, having said that, there might be some bumps along the way, but generally speaking, we are actively working right now to make sure that there is a smooth transition of all those things that you can imagine. It might be IT, it might be data, it might be claims files, it's certainly staff. and have as smooth a transition as possible for January 1. And I'll say January 1. I know nobody is open on January 1, but that is the date of close. And that should produce a seamless experience for you. And I imagine that many of you, most of you, don't even have claims. So you may not be talking regularly to members of the PLP team, but for those who do, you will still have the same individual, subject to any decisions that Navacord and the team will make in terms of file management and organization. So I really hope that the experience for you is going to be not seen. And you will have the same phone numbers, you will have the same website address, and the same staff, as I mentioned. So again, I know that the team and Navacord will want to hear if that experience is not as smooth as it can be. And they'll work very hard to make sure that you will be able to reach someone and be able to talk to someone and to be able to resolve your issues with those members of the team.
Thanks, Dan. We know that both teams have been working really hard, and that is our keen focus for the last couple of months and up until the new year to make sure that that is as seamless as possible.
Leslie,
yes.
could I make one more comment? I
Yeah.
don't want this session to end without just reminding everyone that please look for emails that have already been sent about reporting. There's a concept here about extended reporting, and we want to make sure that if there is anything that you have not reported to PLP that you think might turn into a claim, we've sent a number of emails out reminding you to do that. We want to make sure that nothing falls through the cracks. So again, we'll have information that tells you when those emails were sent. It's on our website. But I just want to make sure that that's another part of this seamless experience, that if there's something lurking that's near the end of the year, we want to make sure that it's captured. Thanks, Leslie.
Thanks, Dan. That question has come through. Like, is there a potential for any gap, or how can I ensure that I have full coverage? And that is the key answer to that. You will have seen the emails, I trust, and it's called notice of claim. There'll also be a small feature about that in our newsletter. And really, it's about letting the PLP team know of anything that you think may have happened. We've also sent that out to the last 5 years of retired RCDSO members. This question has come in again through registration and a number of times tonight, and it's really about what the future is going to look like. So in 2029, will dentists be able to choose their own provider, and how is the college ensuring that a coverage will stay consistent?
It is a great question. And again, I'll just go back to some of the concepts that I've mentioned. But one of the things that we learned in the 2023 survey of dentists is dentists told us in great amounts that we have, I think, essentially 2 generations of dentists who have not had to think about this, that you have been covered by paying your annual fee to the college. And so there's a lot of anxiety about how do I seek coverage and where do I go and what is this going to mean? And that's why we really worked hard to, first of all, find a partner or find an organization that was really committed to this space and this program. And to make sure that they could be in this for the long term and to make sure that it could be seamless. However, we also have an agreement that will really try to build stability. So addressing that anxiety that might exist, build stability so that there's 3 years where, again, dentists don't really have to think much about how they will do this. So this year, as you know, you will provide your $1,500 and the college will transfer that over to Navacord. In subsequent years, the next 2 years, you will likely be able to go through the renewal portal of the college to a site of Navacord, pay your fee there, and then come back and complete your renewal. So we're trying to really ensure that that stability exists. And I know from working with the senior officials at Navacord that they are really interested in working with dentists and understanding what you value going forward and what that needs to look like in terms of a competitive marketplace for them. And so I think you can expect, I hope you can expect that there will be service that is comparable and possibly better than what you've received from the college, and a continued look at the premiums that are involved. So again, no crystal ball, but we have really tried to balance a number of those things that relate to dentists' need to have their certainty, and also the fact that a new organization is coming into this space and is going to, they're going to find their way over the next year and really try to ensure that the dentists are properly serviced in this program.
Thank you, Dan. And I think that's probably all that we have time for this evening. I want to acknowledge that there were a lot of other questions that came in registration and through the Q&A tonight. And after this evening, we're going to go through all those questions and do our best to incorporate them onto the frequently asked questions page of our website. So please have a look at that in the coming days, and we will get to some of those very good questions that you've asked this evening. It makes a huge difference to have these questions. All of them are excellent and practical and forward-looking, so we really appreciate the time that you took to answer those questions, to ask those questions. We have a number of resources that we're just putting in the chat now that you can see, where you can find out more about the divestment program, where you can find the FAQ. So I encourage you to do that. And so, Dan, I'll hand it back to you for some closing remarks.
Thanks, Leslie. And I want to echo my appreciation to everybody for taking the time out of your evening to attend this session. It's been really important for the college to make sure that the profession has accurate and timely information. And I want to just emphasize that communications for us is not one and done. We have, I think, embarked on a long period of providing information and messages that will help you understand this program and this decision. And so, again, the information is going to be continually updated as we work towards January 1st and beyond. As was mentioned earlier, this was an information-only session. So, unfortunately, there's no continuing education points, but I really, truly hope that there's been you're leaving with a clearer understanding of the reasons behind the transition and what it means for you. If you do have any practice-related questions, don't hesitate to reach out to our practice advisory team. They're available by email at practiceadvisory@rcdso.org. You can see that on the screen, or by telephone at 1-800-565-4591. And to stay up to date on college news, resources, and future events, I really encourage you to follow us on social media. We provided you with a number of those platforms earlier. And please check our website regularly. It is changing, and it is really full of useful information to you. Quick reminder that the annual renewal license renewal period is now upon you, and you can log into the RCDSO portal to renew your license for 2026. And the deadline to renew is coming fast on December 15th. So again, thank you for spending your evening with us. We appreciate your engagement. We appreciate all your questions, both before the event and tonight during the live session. And I look forward to connecting with many of you again soon. Enjoy the rest of your evening.